today at Oakton EMT, we're going to have a two-part video. So why are we going to have a two-part video? Because it's best to actually talk about our skill set first and then actually demonstrate the skill set. So today's skill scenario is going to be hair traction application, the use of the hair traction splint. So there's two things we're going to talk about before we actually dive into the device. We're going to talk about the indications and then the contraindications. My indication for a hair traction splint is a closed mid-shaft femur fracture. How do you know, or how can you tell that the patient has a closed mid-shaft femur fracture? One of the things is, before you do any type of assessment and treatment of this patient, is you want to expose both extremities, legs. You want to cut the pants on both sides, you want to cut the socks, and then cut the shoes off and peel the shoes and the socks off like a banana, so you're not causing any more damage to the patient. With that closed mid-shaft femur fracture, the patient's leg is going to be shortened and then rotated outwards. Now look at it like this. Your bones for that closed mid-shaft femur fracture are going to be basically on top of each other, and one of the bones might be actually impinging on that femoral artery. So we have to be mindful of that when we're treating our patients. So that's my indication. It's a closed mid-shaft femur fracture, short and rotated outward. My contraindications for this is, we'll start it very simple, and we'll talk about any deformities or fractures from the hip to the knee to the ankle. Those are my biggest things that we look for, any deformities, again, for the hip, the knee, or the ankle. Now, one of the biggest contraindications for the hair traction application is an open mid-shaft femur fracture. Again, open mid-shaft femur fracture versus a closed mid-shaft femur fracture. Once we've determined our patient has a closed mid-shaft femur fracture, now we talk about the device that we're going to use. We're going to actually use a hair traction splint. Now, before anything happens, we always make sure our equipment is always game ready, but now a few steps occur as you're getting your hair traction splint ready for your patient. One of the rescuers is going to apply manual stabilization, and then they apply manual traction. As they're applying manual traction, this, in my professional opinion, is the best device to put onto that ankle as you're applying manual traction. This is the ankle hitch. As you wrap it around your patient's ankle, this gives you that extra leverage as you're applying that manual traction for your patient. And as you're applying that manual traction, when you started off at manual stabilization and manual traction, you're assessing your patient. You're assessing those pedal pulses. You're assessing that popliteal artery. You're making sure he's got good distal motor sensation, or central motor sensation, or peripheral motor sensation. Whatever your instructors are telling you to use, and whatever the textbooks that you're using telling you to use to assess that patient. Now we have the ankle hitch on our patient. The first strap, or the first thing that you're going to do, is you're going to measure, right? You measure on the uninjured side. You start off at the ischial tuberosity, which is all the way up here, approximately 6 to 10, 6 to 12 inches on the uninjured side from that foot, depending on what your literature or the readings or what your instructors are telling you. 6 to 10, 6 to 12 inches on the uninjured side. Now we've measured it. My partner is holding manual traction. I insert this on the injured side, right all the way up to the buttocks. I apply the ischial strap, which is your first strap to your patient, and then I apply that mechanical traction. Now we look at the actual device itself. So as I'm measuring this is like a telescope or a trombone, if we remember what a trombone is. You loosen up these black securing mechanism straps here. You loosen them up, and then you're able to slide this up, right? Again, like a trombone or a telescope. Once you determine the actual distance from the uninjured side, you secure it hand tight. Your kickstand is dropped down, and this right here mechanism is used to apply that mechanical traction. On the uninjured side is where you adjust your securing strap. 2 above the knee, 2 below the knee. The 2 above the knee, make sure that it's not over the actual injured site. So as you're adjusting your securing straps, all you need to do is just adjust it over the device, and then you lay it out game ready. So when you're ready to insert this underneath your patient's injured side, you're all golden. So now my securing straps are set up. I have the proper distance. My rescuer, my partner, is holding manual traction. He lifts up his leg a little bit higher, and I insert this right underneath my patient's butt. Again, all the way up to the ischial tuberosity. From there, I apply the ischial strap, first strap. I go straight down to the mechanism. I apply that mechanical traction until the patient's sighs of relief. From there, I reassess my PMS, DMS, CMS, and then I apply my supporting straps. Again, if you like us, follow us on Facebook, Instagram, and on YouTube. Oakton EMT. Thank you.